Hi, I'm Dr. Tammy Atkinson from the Chiropractic Pain and Injury Center. Today I'm going to be talking to you about disc injuries. I have a number of patients that I see in my office that suffer from disc injuries. And there are different types of disc injuries, and I want to talk about them today. So if you look on the left side of the screen, you will see the spinal column. In between each of the vertebrae, you're going to see a disc. And a disc is, you can think of it as like a spacer between the vertebrae. It is made up of a gel type material, and that gel can actually get compressed. So the first type of injury that a person can suffer from is a disc bulge. Now on the right side of the screen, what you see is what we call an axial view. And the only way to actually determine if someone has a disc herniation is to do an MRI. So this is a slice through an MRI, and you can see what's called the axial view. There are, in addition to disc bulges, which this is a disc bulge, the next type of injury we have is a disc herniation. And there are three types of disc herniations. First, there is a disc protrusion. And the disc protrusion can present itself in three different ways. First, the disc can compress on the right side and hit the right nerve root and be a right lateral disc protrusion. And as you can see, the disc material has herniated out and was sitting on the nerve. The next is a central disc protrusion, and that also is compressing down into the spinal cord. The left side is called the left-sided disc protrusion. And you can see over here on the left side how that disc has now herniated and it is pushing down into that nerve root. Now there is a second type of a disc herniation, and this is called an extrusion. So that is where the material comes from the disc and pushes further out and sits further on that nerve. This is what an extrusion looks like. And the third type of disc herniation is called a fragment. It's a free fragment. It's also called sequestration, and that is extremely painful. All of these are very painful for a patient. So these are different types of injuries that can occur as a result of having a disc injury. So you have the disc bulge, you have a disc protrusion, which is a herniation, and you also have a disc extrusion as well as a free fragment. So these are the type of issues that I do see in my office. So the next time I will be doing a video, I'll be talking about why the disc pain actually hurts as much as it does. So I hope that this has been informative for you, and I'll look forward to seeing you on my next video.